Hey guys, it's Dr. Emer in West Hollywood, and we are doing an InstaLift procedure today. This is where we take these sugar-based sutures. You can see them here. They're pretty long. They have 8 cones, these types. These cones grab onto the skin and lift the skin over time. You can see those here, see? And the cones are made of a sugar so that when it dissolves into the skin, they produce collagen and tighten the skin. This is great for prevention. My younger patients love this because they want to get lifting and tightening, especially if they're thinner, or if they've had a lot of weight loss, or if they're just overall having early signs of aging. And we use these threads to really shape and contour various areas of the body. Here we're doing the cheek and neck area for someone who's super thin that wants lifting and tightening. And in this case, in this scenario, I'm going real high in the temple up into the hairline, similar to what somebody would call a ponytail lift. And we're using those sutures super high, up, all the way along the zygoma to get lifting through her lateral cheek. Fillers can be used to contour here, but this suture, it's going to feel a little tug here because we're going to go right on the bone. Hold on. Into the hair. Good. I'm just going to pull that there. Perfect. And you can see that suture went right in there, holding that all together. It's going to grip tight and it's going to pull her lateral cheek up. Now the cheek's now been finished, and you can see here, I'll show you guys really carefully, the threads that we placed here are very high. Look at the amount of movement we have now in the cheek. So we can actually secure the cheek pretty high, about 2-3 centimeters here, giving her close to what we would get if we did, pseudo mid facelift. So now we're going to go down onto the neck. This area is a little bit different; it's a lot thinner. How we place the thread is very differently here. So we're going to go nice and slow, cautiously, right along the platysma, go right up into the lateral or the medial part of the jaw. Feel just a little bit of tightening here. Good. And keep your chin up for me. Great. A little bit harder to place here. Again, following right under the jawline. So I want to get her a nice lift there. Good. And then again, these are bi-directional cones. So you see we went in the initial direction first, which was on the anterior midline part of the neck. Now we're going all the way back, posterior jawline. By the ear. You see that placement here. And you can see, look, how much pull we're going to get here on the jawline. It's going to be pretty good if I have to say it myself. So it looks complex because it is. The key component to this is the markings. So these purple lines, they are not just made up. These are meticulously measured to ensure that we have exactly where we want these sutures to be, because otherwise you're going to have a lopsided neck and a poorly planned result that will not tighten. But we have a younger patient here and who's thinner, who just is noticing early signs of aging, some mild sagging. We want to improve that. Good. Anyone saying anything, guys?
What's the pain level?
What's a pain level 1 to 10?
0.
0. Wow. Below a 1 to 10. That's fantastic. She is the highest pain tolerance of anyone. Most people do not feel pain from this procedure. We don't use topical numbing. We typically are only using injectable numbing at all these spots. That's why it's a little smeared, as we call it in the New York Jewish community. It's a little smears right there when you get on there. Or that's the 1 inch required amount of cream cheese on a bagel on Sunday morning at a bagel restaurant in New York. That's what I call it. So now we're going to do the last one, and I'll show you guys what the neck final looks like. Now for her, we're actually doing a little bit more. I'm going lower on the neck than we typically do because I want to get a little bit more vectoring for her. She really wanted super tight as we can get it with a non-invasive. And with her, look how thin. You gotta go really cautiously. This is because I think because of my experience doing lipo and really understanding planes and anatomy, I understand what it feels like to be in that platysma muscle, that we're not gonna get any complications. We're being really cautious, and as you can see, it's basically bloodless. Very minimal bleeding, almost nothing, and minimal pain. So we're itching right up there, laterally, and on top of one of the muscles of the neck right here.
Is there any soreness after?
Yeah, I mean, there's going to be a lot of tightness because we're going to pull these tight at the end, which I'll show everybody in a second. Great. So let me just show you guys here. Go ahead and cut that for me. There'll be a little bit of soreness, but it's not too bad. I just tell people you really want to avoid excessive exercise. So look, that's how much tightening we're going to be able to get. Not too bad. I can show you from both sides really well. And again, that anchoring right there in that middle is what a bidirectional cone can do. It can create the tightening that we want right under her jaw. So we've done the upper face here, we've done the lower face here. That's going to build collagen over time. Come back in a few minutes when we finish the other side and I show you the tightening.